Hi guys, I'm Jivitesh and this is the WYHF, and don't you dare get distracted for the next few minutes.
Because this can cost you a life.
Or help you save one.
Because this very important video is about CPR or cardiopulmonary resuscitation.
Did you know that this basic skill can double and up to triple the chances of survival after a cardiac arrest?
So let's learn about the basis and principles behind CPR.
Our heart is the miraculous pumping machine that works tirelessly day and night so that all our organs can receive oxygenated blood for their normal function. However, this miracle can stop working. The reasons can be numerous and all of them can't be discussed over.
Causes of collapse or unresponsiveness. Here we are displaying the names of conditions that can lead to a cardiac arrest. You don't need to memorize these because the basic CPR skill set remains the same no matter what the cause is. You can pause this video and take a screenshot if you like.
Now this condition is called cardiac arrest or sudden cardiac arrest. If the patient is not able to survive this condition, it's called sudden cardiac death. And this is what we intend to prevent. When the heart stops, the condition might be irreversible and the patient cannot be saved. However, a lot of times, the disease causing cardiac arrest can be reverted or reversible. And if blood supply is maintained to the vital organs like the brain, kidney, lungs, till the time professional medical help arrives and tries to revert or reverse this disease, the patient can be saved. And this is where CPR helps. Basically, during CPR, we try to mechanically push blood out of the heart into the big blood vessels so that it can supply the vital organs. The principle is simple. We give good quality compressions over the chest wall and thorax so the heart is mechanically pushed and the blood is pushed out of the heart into the big blood vessels so that it can supply the vital organs till the time professional medical help arrives.
And all this while definitive medical help is on the way. Remember, CPR is not definitive treatment. It is a last resort to try and ensure that blood reaches the vital organs of the body till professional help arrives. So that if they're able to resuscitate the heart, the other vital organs of the body are still functioning till then.
So, what exactly do we do?
So coming to the main part, what to do if you find a person collapsed or collapsing.
Shout and call for help.
If someone's around, ask them to call an ambulance and you start assessing the patient immediately. Ask them to come back as soon as they're done because you'll need their help during CPR. If there's no one around, you call 108. Tell them that there is an unresponsive patient, tell them about your location and start assessing the patient immediately.
Step 2. Observe and assess. Look, press, and feel.
Look, press, feel. Look. Look whether the patient is responding to being called or not. Look whether the patient is breathing or not. Remember, agonal gasps like do not mean that the patient is breathing normally. CPR needs to be started. Press. Press firmly over the center of the chest to check whether the patient is unresponsive or not. Feel. Feel between 2 points. The prominent point in the center of the neck and the neck muscle. The point in between is where the pulse, carotid pulse lies. Press for a minimum of around 5 seconds and a maximum of around 10 seconds. If there's any confusion, start CPR anyways because time just cannot be wasted. Remember, assessing the patient has to be really quick. If you have someone around, it should be done within around 10 seconds. If there's no one around and you have to call for help yourself, it should be done within 30 seconds to 1 minute and CPR should be started within that time. If there's any negative response for look, press or feel,
Start CPR.
once you've assessed that the patient needs CPR, make sure that the patient is lying flat with his face facing upwards and you sitting beside the patient, ideally at the same level as the patient is lying down. For simplification purposes, we're using a pillow. You can use the same or a rice bag of around 5 to 10 kgs to practice at your home. Use the heel of your dominant hand to press on the center of the chest of the patient in between the nipples. Place the other hand on top of this hand and interlock your fingers like this. Before you start compressions, ensure that before and during compressions, your elbows remain straight and your shoulders are lying directly on top of the chest of the patient. This ensures that your body weight is used to deliver the maximum force with minimum effort. Now start delivering good quality compressions at a rate of 100 to 120 beats per minute. When you're delivering chest compressions, ensure that the compressions should be at least 2 inches deep. This allows the blood to actually flow from the heart into the deep vessels. Also, when you're compressing, make sure that in between 2 compressions, you're allowing the chest to recoil back. This allows blood to actually fill back into the heart so that it can be pumped back into the vessels during the next compression. Continue doing this for as long as you can or until medical help arrives. If you have a companion, make sure you keep taking turns because it can get very tiring. If possible, give 2 mouth-to-mouth breaths to the patient after every 30 compressions. This allows oxygen to enter into the system and helps in preserving the vital organs. Remember, during the times of COVID, this step should be skipped because it can risk exposure to you or your surroundings. Also, it's better if you cover the face of the patient with a cloth or any other material so that aerosol dispersal is minimized. How to remember all of this?
SOS.
Shout and prepare.
Observe and assess. Look, press, feel.
Start CPR. Now that you've learned the basics of CPR, you can revise and practice the steps on a pillow or a 5 or 10 kg rice or flour bag.
Imagine yourself in such a situation and enact what you will do.
Although, we sincerely hope that you never have to do this.
Also, record yourself while doing this and send us your videos. We can give you feedback about whether your technique is right or there's something that can be changed. You might get featured in one of our future videos as well.
And finally, like always, like and share our video, subscribe to our channel and spread word about the WYHF and all the good work that we are and will be doing.
Still haven't taken the Beats for Life challenge? Do it now. It will help you memorize the speed of compressions in CPR so that you do not mess up that crucial step.
So until next time, stay
Stay
hearty
hearty
and stay
stay
healthy.
healthy.